segment is sponsored by the McCaffrey Health Center. Well, recent numbers show that more than 15 million Americans have been taking antidepressants for more than 5 years. And those numbers have more than tripled since 2000. Here now to discuss why this could be happening is Dr. Sean McCaffrey with the McCaffrey Health Center. Welcome back, Doc.
Great, thank you.
All right, so what are antidepressants primarily prescribed for, and how do they work within our bodies?
You know, the biggest key to them, you're focusing on a number of symptoms, because depression technically is not a disease, it's a syndrome.
Okay.
So it's not like heart disease where you can say, oh, it affects the heart, or it's diabetes affects the pancreas. It's more of a syndrome. So it's a collection of symptoms that the body goes through. It can be everything from mood changes to PMS to headaches. There's all kinds of things they'll use them for. Now, how do they work? There's different classifications, but the majority of them tend to block the reuptake of different what they call neurotransmitters. Serotonin's the big one that most people know about. Dopamine, norepinephrine, those are ones you see a lot. And so what these things do is they stop the body from reabsorbing that, and the longer those neurotransmitters stay in circulation, the more calm the body can be. So that's really the principle behind it. Slow down how fast they get reabsorbed, but that's kind of a hit and miss thing.
Yeah, so are these drugs primarily used for short-term use?
Well, they're supposed to be.
I mean, because 5 years is a long time to be
it's
on
way
something.
too long. It's way too long. And that's the problem that we're running into here. These were meant to get you through, life's falling down around me. I have to have some catastrophic thing. I just need to get through it. 3, 4, 5 months, 6 months, but not much longer than that. And what we're seeing now is that we have tens of millions of people that have been on these things 2, 3, 4, 5 years and no idea how to take them off.
Well, a study came out last week, I was reading, and it said long-term antidepressant use is linked to dementia. So talk a little bit about that. What are the effects of taking it for 5 years or longer?
Well, and that's the thing, we don't know. They have no studies. There's not much out there. See, when these were made, they were designed to be done in short little intervals. So the companies that make these, most of the pharmaceutical companies, and all the big boys make 1 or 2. All these guys make these things. They do short-term studies and like, oh, here it goes. Then once you dump it in the marketplace, now doctors get a lot of leeway with it. They're like, well, we can use it for off-market uses. Off-market may be, hey, you're going to be on this for the next 10 years. And they're like, well, there's no harm to it. The problem that we're finding now, though, is that we're seeing dementia as an example of something that's kicking in. When people try to come off of them, severe headaches, migraines, shakiness, nervousness, all kinds of things that are going on. So it's a catastrophic effect that's occurring as they're trying to pull themselves off and wean themselves off. Now, if you go on some of the websites for Pfizer and places like that make some of these antidepressants, when you say, what's the incidence of this happening? Oh, 1% or more. And the or more is a blanket term that says, well, it could be 90%, but it's more than 1. Well, the studies that are now being done, because people are starting to look, we're now finding that it's closer to 50, 60% of the people that try to come off of these. It's not 1. It's 40, 50, 60% that are struggling with this. Okay, so if we're taking them for 6 months or a year or 5 years or whatever, and we decide tomorrow, oh, okay, I'm done, I'm good. I mean, cold turkey, what can that do to stopping this? Well, the chances are you could have a side effect. Well, that's what we're looking at here. And the side effects can be severe. I mean, you can go from nausea to headaches to tremors to shaking. All kinds of things can occur, like you see in withdrawal from other drugs. Like you'd see if you were a heroin addict or a cocaine addict. You can have those kind of withdrawal effects. So the key is you have to do it carefully and safely. Now, one of the problems we have is that the doctors that are prescribing these right now really have not been educated from the pharmaceutical industry on how to wean somebody off of these things, because they were going under the idea that, well, there's no problem with these, they're perfectly safe, there's no side effects. Well, now we're finding out with these new studies that are coming out that, gosh, 50, 60% of the people that are coming off of these are having massive side effects. So the doctors now don't really know what to do. We can wean off slowly and things of that nature. So you have to go to ones that have been trained in addiction. You know, one of the things we do in practice, I've done it for years, is that we did addiction therapy. We learned it through acupuncture, we learned it through herbology. There's ways to help people wean off of things, but you have to do that in coincidence with their primary physician. So you guys got to work together and try and help people get off them safely.
Don't try to do it yourself.
No, I wouldn't.
Okay, so switching gears, I know you guys are running a special this month for new patients. It's called Spring Back to Health. Tell us about it.
Yeah, it goes with what we're talking about right here. You know, depression, anxiety, reason why you're taking all these pills to cover up symptoms. We're doing our Spring Back to Health because it's our way of giving back to the community. It's our way of helping people come in on a reduced rate. We do a $99 consultation is what we're offering people, where they can come in for half an hour. We can sit down with them and go through their history and try to help them figure out the why. Why do you have depression? Why do you have this pain or that pain? Why are you taking these 5 medications and not getting where you want to be? So if we can help someone just have that moment in time where they can kind of figure out what's wrong, why do I have this, then we can help them out.
All right, sounds good. Well, if you'd like to learn more about their new patient special or to see some of our Wellness Wednesday videos, visit McCaffreyhealth.com. Doc, we'll see you again next
Great,
week.
thank you.
Thanks for being here.